This is the second half of the conversation with Dr. Megan Neff, a clinical psychologist who has a special interest in working with those who are autistic. Last week we were talking about autistic burnout. And we will pick up the conversation as well as talk more about self-help tips for those who are living with an autistic-style brain and nervous system. Remember that while I am a doctor, I am not your doctor. All of your signs and symptoms should be discussed with your physician. And now on to this week's episode. Can you give some examples of triggers or scenarios that or patterns that you've seen?
So patterns of like reactivity in the context of burnout, or just?
Yes, that might be preceding and fanning the flames that heightens to lead to a burnout or intensifying it kind of situations. Maybe infection or biomedical illness, but thinking of more of a spiritual, environmental, social kind of thing that may be.
Yeah. So what predisposes us to developing burnout? Yeah. So I think if we take the general framework, and that this again comes from the Raymaker study, they conceptualize it as when the stressors outweigh our ability to cope, and with our ability to cope plus accommodations. And then a lot of us, especially for adults, we aren't formally identified. So a lot of us don't have accommodations and supports. So I think of it as it's something that often has developed through a lifetime of overextending ourselves. And especially if we don't know we're autistic or ADHD, we are often holding ourselves to these standards that frankly aren't realistic for us, and without the supports in place. So just as a basic equation, that's how I conceptualize it. And then absolutely, like what you're saying, that I think some times that we're really vulnerable to this are during life transitions. So maybe it's starting a new job. And then if the person's autistic or ADHD, there's going to be extra stress of that, like entering a new system, learning a new system, masking, like the masking that goes on. All of these things are things that load our system with strain and stress. I think adding a child, that is absolutely something for me. That was definitely, I think, when I first started experiencing burnout. And I think the combination of how hard my pregnancies were on my body physiologically, but then that's a huge component you're adding into a person's life, is caring for another human, sleepless. So there's definitely these, I think, seasons where we're more vulnerable to it. We know change, that's hard for autistic people's systems. And so there's going to be extra stress as a part of that. In regards to what some of the research has found, a lot of the drivers that make people more vulnerable to burnout are things like masking. So that's when we are actively suppressing our autistic traits and mimicking kind of allistic communication norms, as well as having co-occurring mental health conditions or something called alexithymia. I don't know if that's something you cover in your work, but that's difficulty identifying our emotions, or that lack of self-awareness. That's something that also predisposes us to burnout. And that makes sense, because if I'm not aware of what I'm feeling or what I need, I'm not going to intervene in the stress cycle as early. And so it's going to build up and it's going to build up. So these are some of the things that can make us more vulnerable. But I tend to think of burnout as something that develops, and it's a slow grade thing that comes on over years, which is part of why it can take a long time to also recover from burnout.
So for somebody who's experiencing it, it may seem like it comes out of nowhere, but the pot of soup has been simmering and then the heat gets turned up and it turns into a boil. Is that one way of thinking it?
Yeah, I like that way of thinking. And it's probably, they probably felt like they're barely holding on. And then it's that one potato that gets added. And then all of a sudden the water's boiling over because you just added you added some volume to it. So yeah, it's the one kid, or it's the second kid, or it's the transition. And all of a sudden I was able to cope, and now everything has come crashing down.
So somebody realizes, they're listening, that they have autism. Part of describing this as being autistic burnout. What can you say to them who are and have gone through it and now working forward to help fireproof, so to speak, as best they can from a future challenge?
Hmm. Yeah. So one of the places I encourage folks to start is with the sensory. And especially if someone is listening and they're coming to learn this about themselves later in life, one trend I noticed is a lot of us will dissociate from our bodies. I lived a very disconnected life from my body until I came to understand this about myself at the age of 37. And it's a response to the sensory overwhelm. And so learning about your sensory experience of the world, even if you're an adult, it can sound really simple, but that's often the place that we have to start is with building in sensory safety. I as going through therapy training, right? A lot of what we learn is things like emotion regulation practices and all these practices. None of that really matters if we're trying to regulate emotions on top of a dysregulated sensory experience. That's not going to really touch it. And so we have to start with sensory regulation and sensory safety. But that's often what gets missed. And so I often encourage people to start with sensory and cultivating sensory safety, which often requires like learning about your sensory profile and your sensory experience. Practices, building in nervous system breaks, building in breaks. Autistic people need a lot of rest, and it's frankly annoying how much rest we need. But the more we can really create those periods of deep rest, that's often necessary for part of the burnout. And then this is a hard one, but partly because I realize it takes a lot of privilege to be able to do this. For a lot of autistic people, it's the life we were living that burnt us out. So for a lot of us, we have to pretty dramatically reconceptualize our life and restructure our life to build a life that's truly resistant to burnout moving forward. Now, that takes a lot of privilege or a lot of support to be able to do that, which is why that's one of the harder pieces of advice for me to give.
And that covers a broad swath of socioeconomic and situational, from having a spouse who understands you're autistic and understands your needs to somebody who has not a supportive partner and has maybe 3 children, with 2 of them also being neurodivergent, who have a hard time self-regulating, and that can be a worst case scenario. And unfortunately, when somebody's struggling, there can be quick fixes that momentarily help, but aren't long-term solutions. If you want to comment on that.
I think there's a reason. I'm not sure if this is where you were going with it, but I think there's a reason. One thing we see high rates of substance abuse among ADHD and autistic people, especially those who don't have a co-occurring intellectual disability. And I think part of that is people are trying to they're using substances to try to regulate their nervous systems. And I call it like faux regulation because it's not actually. And I think this increases during burnout and with masking. And I understand it. I understand why people go for the quick fix of my kids need me, my work is stressful. But yeah, a lot of us fall into unhelpful coping patterns because we're trying really hard to survive. And we end up leaning on things that are actually making our system struggle more.
And that can lead to hopelessness. It's a
Mhm.
cycle. We know that opioids actually typically heighten pain sensitivity long term. We were talking before we went on the air in the book, Is It Autism? And the documentary Understanding Autism that's streaming on PBS, about the co occurrence of suicidal thoughts and attempts.
Yeah, and this goes back to bring it back full circle to the training conversation. This is one of the reasons I'm so passionate about getting this information out there because in training programs, we're not taught that. We're not taught that when a patient or a client has a history of suicidality that you should be screening for autism and ADHD. I think autistic women is one of the most at-risk groups for suicide. And frankly, I understand it deeply. Yeah, that makes sense to me, especially when you throw in chronic pain, right? Outside of autism and ADHD, the chronic pain population is also a high risk population. Then when we're talking about autistic ADHD people with chronic pain, with fibromyalgia, I don't think I even want to see the results of that study. I think it would be so astronomically high.
And if people have been to many providers, they've lost hope. And that's part of it. They've sought help and tried to do traditional ways of therapy, and it hasn't responded. Is another tangential thing related to this. I don't know if I've read, I probably read a lot, that a sign that you may be autistic is you've been to many therapists and done cognitive behavioral therapy and you haven't responded. Any
Yep.
thoughts or studies on that?
My thoughts are, yep, absolutely. Yeah, no, it's so weird because CBT is often, this is what you should do for autistic people, but for many of our brains. Yeah, this is part of, I look for the constellation when I'm thinking about back when like doing assessments. And there's part of the constellation is often a long medical history of both health things, but also a long history of mental health conditions and then poor response to treatment. Partly because the underlying neurotype has never been understood and it's never been supported. And so they might get some movement on the anxiety or the depression or the PTSD, but until that underlying neurotype is understood and supported and there's self-understanding, those things are going to linger and they're going to persist. So yeah, when someone's been languishing in treatment for years, for me, I'm like, okay, screen for ADHD and autism. That's a pretty clear sign that there might be more going on.
And I think we, in my career as a medical student, doctor, have screened, and likely everybody listening, at least in the States and probably much of the Western world, has had at least one time screening questionnaires with the PHQ-9, a depression screener, as part of at least an annual checkup, often for teens through adulthood. And there are a lot of good things identifying it. I was at the APSARD ADHD conference in January, and they brought up it would be nice if we just screened to mention ADHD at least once in somebody's lifetime. And I think a lot of these are conditional screening. As one of my supervising doctors said, you kind of screen for this, don't you? And it's what's there. And then if there's a constellation, you're going to ask that. If nobody's ever had that, they're a healthy 40-year-old woman with a great life and they just are coming in for a checkup because they need to get $1,000 off their health insurance for the year, and they're coming in and they are functioning great and they have none of these problems. They could be autistic with the best support system ever, but by the time
Probably
you're
not if they
40,
don't have health things.
but by the time you're 40, you probably had by
Yeah.
chance situations and stressors in
Uh-huh.
life that it would have likely brought it out.
Yep,
And
absolutely.
that's and often who comes to the doctor, people who have these chronic
Yeah.
health issues, and they're showing up and they're not getting that. So hopefully more who are listening can be thinking
Uh-huh.
about it and going, oh, that's interesting. That really helps make a lot of sense.
Yes.
What impact has this had for your clients who you've worked with, your patients, when these dots are connected in their lives?
First, I want to say about the screening. This is actually something I advocate for pretty much anytime I talk with a group practice, or I'd love behavioral health programs, medical providers to start screening for autism and ADHD, both because it's going to catch a lot of people, but also we need to do a lot of destigmatizing work. And if people are routinely screened for ADHD and autism in the same way they're screened for depression, anxiety, that's going to make it a much more comfortable conversation to start. That question comes up a lot with clinicians of how do I introduce this to my client? I'm afraid I'll offend them. Like the more we screen for it, the more we normalize it and the more we destigmatize these things. So, first, just okay, that was about screening. And I think more and more healthcare systems should do that. You asked a question that broke up a little bit, but about how connecting these dots can impact people. Was that the question?
Yeah, yeah. When you are working with patients and are able to then take a listen, take their history, and bring things together, and then share with them that they're autistic
Mhm.
and
Yeah,
what
yeah.
impact that has had on them.
So there's a range and it depends on a few factors, but mostly what I found is that it provides a lot of liberation in the sense that things click into place. Like I often describe when I discovered this about myself and when I was diagnosed, it felt like 100 mysteries were all of a sudden solved that I thought I would never get answers to. So I think for a lot of folks, there's a profound sense of liberation that comes with, oh, this fragmented life I've been living, there's actually an answer to it. And a lot of us, it's so interesting because providers are so afraid of putting this label of autism on someone. What they don't realize is that we already have labels. Like there were so many labels that I was able to discard once I put on the autism label and the ADHD label, like labels of being incompetent, being lazy, being too much, really sensitive. So that's something I see a lot is people are finally able to be gentle with themselves and realize I'm not broken. I'm different. And this is a valid difference that I have. And this explains my differences. So I often see a powerful sense of liberation when someone has an accurate lens to understand themselves. Closely after that comes grief. Grief about how come I didn't know this earlier? What could have been prevented if I'd known it? Grief about limits. I talk a lot about how much I have to grieve the limits I have, as I have a lot of sensory limits. I have a lot of energy limits. And that's grief work. It's grief to accept I'm not going to find a magical diet that all of a sudden makes me feel wonderful. I'm always going to have more limits in the body that I own. And it's interesting because I often see a pretty common trajectory for people of this process of liberation, grief, sometimes rage, and then ultimately and ideally landing in a place of empowerment and agency and more powerful kind of self exploration and identity work as they come to understand themselves through this new lens.
Couldn't agree with you more, a lot of those are what I've seen working with patients of mine, and nice to have you echo those. Moving to a next chapter of this conversation you have a book, Self-Care for Autistic People. It just came out in March. And as I was saying before we went on the air, when I asked you to be on the podcast, I didn't even know that you had been about to publish a book on this. And one of the reviews came back so positive from Donna Henderson, who wrote Is It Autism?, which is a great 2-volume look at autism for clinicians, but really for engaged patients and for physicians out there, and actually for of all types, from psychology, therapy to medical doctors, to learn more. And now how we can understand it and from diagnose it, understand it, put perspective, lots of great studies. And now let's practically support somebody, yourself, self-care, and also, of course, if your spouse is not autistic, how do you support somebody like yourself who's going through autism or is autistic and help that? So can you talk about how self-care for autistic people may, obviously, some bird's eye view of being the same, but in some granular level may be different?
Mm-hmm. Yeah. Yeah. One thing I hear often from our community is traditional self care practices just don't work for me. And that's absolutely been my experience too. So, one, I think there's just, and I felt this going through my training program of every time I learned a therapy technique or some kind of technique, I always felt like I had to twist it to make it fit my brain. So, there's a lot of kind of twisting of things to make it work for us. I think at the bird eye view, what changes? I'm going to start sounding like a broken record here. The first chapter in the book is about sensory self-care. And that was really important because that's the foundation. Without sensory self-care, again, it just doesn't really matter what other self-care you're throwing in there if you're trying to put that on top of a dysregulated system. And so I think that's something that's pretty different. Unless you have sensory sensitivities, a lot of the world just isn't even considering sensory demands or sensory inputs in thinking about moving through the world. And so that's still a pretty new idea for a lot of folks. The other part, and I'm so excited that you're going to have Kelly Mailer on next, I think,
She
soon to
already
talk
was
about.
on.
Or she already
By the
was
time
on.
by the time
Okay.
this is live, she was on back in the end of May or beginning of June, end of May
Beginning of June. Okay.
2024. So she's
Well,
already on.
she was already on. I'm excited to listen to that because she talks about interoception awareness, and I've learned so much from her. But a lot of autistic people, we struggle to be cued in accurately to our body signals. And one thing I say a lot is self-care relies on self-attunement. If we can't attune to ourself moment to moment, we don't know what we need. And there's a lot of reasons that's hard for autistic people. Interoceptive awareness, but also masking teaches us, let me cue into other people and not myself. Pain, like pain and fibromyalgia, we can dissociate from our body because of those experiences. And so learning that ability to tune into ourselves and our needs, I think that's foundational for autistic self-care, which can be challenging for a lot of us. So again, we might need to manipulate practices to find ways that work. So those are a few of the things that come to mind in regards to what's different at the foundational level when we think about self-care for autistic people.
Can you give us a summary or some of the chapters that you have in your book? Is encourage people to check it out and get it, but can you add to more? What are the chapters or outlines in your book?
Yeah, absolutely. So it's formatted into 8 different. I'm having brain fog today, so let me. Is it 8 or 7? I think it's 8. I'm gonna actually pull it to no 6 chapters. So it's broken up into 6 chapters. The one thing I like about the format is they're all entries, and so they're 1 to 2 page entries, each with just a tip or an idea that you could try this today. And it's intended that way to not overwhelm people so that they could pull out the book if they have 2 minutes and be like, oh, okay, this is something I'll try today. And then all of these entries are divided into different categories. So, like sensory self care, physical self care, emotional self care, mental self care, social self care, and then professional self care. In the emotional chapter, I talk a lot about things that help improve our awareness. Because again, about 50% of autistic people also have alexithymia. And when you have alexithymia, 0, 2 to 10 really fast, and you aren't experiencing the 3, 4, 5, 6, 7, 8, like in regards to stress or rage. This is another reason we get misdiagnosed with borderline and bipolar. And so increasing that emotional awareness, that's really foundational for our emotional self-care and health. So a lot of those entries are focused on here's some things you can do to increase that emotional awareness. I've never been someone who really leads with like big feeling emotion words. It makes me want to shut down. So one thing I talk about a lot is I tend to access my inner world through my mind. And so sometimes for autistic people, the way we access our inner world and our emotions might look different. It might be through metaphor, it might be through philosophy, it might be through your ideas that you actually are able to tap into your emotions. So again, I think there's some ways that if you tweak some traditional things to work with you, you just have to figure out what works for your experience of emotions and how you articulate them.
Yeah, and I look forward to getting it myself and reading it and sharing it with others. Any other thoughts that you have?
I have lots of thoughts, but I'm really bad. Part of being autistic is I'm really bad at big, broad questions.
Any other comments about your book at all?
But one thing, my hope for this book and the feedback I've gotten from people that's been the most meaningful is that this book taught me about what it is to be autistic. I think a lot of we don't get a manual of this is what the autistic brain or the body is like. And I think for self-care practices to work for us, we need to understand why they work. Like understanding why is so important when you're autistic. Like autistic children ask why a lot because they need to understand why. Why? So I think there's a lot of explaining I do in this book of here's how your nervous system works. Here's why this might be helpful for you. And so my favorite feedback I've gotten from people are people who are saying this really has helped me understand what it means to be autistic in a practical way. And so that's the hope that I have for readers that they'll take from it is that they'll learn something about how their brain and their body works in a way that they can care for themselves and advocate for themselves a bit better.
A used metaphor in the world of fibromyalgia is that living with this can be like you're blindfolded, bound, and tortured by an unknown assailant without any recourse for relief. And the hope is that with the podcast, the book, and books like yours, is that the blindfold can be taken off so that you can see and understand and not feel like it's haphazard and there is no agency. There are things that are out of your control, but recognizing that we do have an understanding of this and we can help moving forward. And with that, I always like to close with having expert guests like yourself to talk to three groups of people. One are those who are living with these kind of things, with an autistic style brain and ADHD style brain, who often are living with these chronic overlapping conditions. Their loved ones, their spouse, their coworkers, neighbors, and help them and to speak to them, and also for all of the clinicians out there. So if you could maybe talk to those three groups of people.
Can you help me out and help make the prompt a little more specific for my
Okay,
brain?
if you have somebody who's listening right now and they are struggling, they haven't met somebody like you or me, they're somewhere in the world, and just in a couple minutes, share what you can offer hope or advice to them listening, what they can take from this as a summary and steps moving forward. If you can give some hopeful words to, first, if you are autistic and have been misunderstood and are struggling,
Okay. Yeah.
speaking to that and offering an uplifting, hopefully, tone to that group first.
Yes. Okay. I'll do my best. I think the easiest for me to respond to are probably the autistic and ADHD folks. And first, I think the big message I would hope they take away from is that you're not broken. And you probably have so many internal narratives and scripts about the fact that you are. This is a different neurology and it has both strengths and challenges. And your people are out there. I think for me, one of the most powerful things about discovering this at the age of 37 is that I've found my people. I've found the folks for whom conversations flow naturally. And I didn't think I'd ever get that. So tapping into neurodivergent culture, autistic culture, ADHD culture, there can be a lot of pride in that, but there can be a true sense of connection and belonging that is incredibly powerful. So I think for autistic and ADHD folks, the two big things would be know that you're not broken and know that your people are out there and see if you can find them and find connection and belonging. For healthcare providers, I'd want to just thank you for listening and learning because that's huge. And screen for autism and ADHD, that's just my general advice for healthcare providers. I think there's probably a lot of folks listening who are neurodivergent healthcare providers, frankly. Okay, maybe we want to do some editing.
Yeah, no, that's perfect. Yeah, I 100% agree with all of what you've said. It's so nice to have you on. And maybe lastly, supporting if you are somebody who doesn't have an autistic brain and their spouse does, their friend does, their loved one, their child, their parent has this, any words to them.
Yeah, I think again, learning about how their brain works, how their communication works. One thing that we're learning is autism is not a communication deficit, it's a communication difference. And so learning how their brain works, how their communication system works. One thing I talk with, especially parents, a lot about is developing a sensory lens so that you can perceive what is your child's experience of school or of their day through that sensory lens. What are the hidden sensory demands that you maybe are not even aware of? If you're saying, hey, let's go to a restaurant for dinner, are you thinking about that through a sensory lens of what are the demands I'm asking of this person? Or for partners also to think through, why does my partner not want to go to this family event or this event? Are you considering the sensory lens? And then communication. I think communication is so important when you're in a cross neurotype relationship or family. And so developing co-creating language as a family to be able to talk about differences. There's a lot of, when you're in a neurodiverse family or partnership, there can be a lot of clashing needs, clashing sensory needs, clashing values. The more language we have to talk about this, we're able to externalize it and problem solve versus locate it like in the person, like you're making me upset. And so I think communication and cultivating language that's shared become so empowering when you're in a neurodiverse relationship of any kind.
Thank you so much for being on the podcast. And if you could tell us how they can, one, get a hold of your book, and tell us again the name of your book, and also how they can get a hold of it, and also how they can get connected with you on the internet, both from the resources you have and if they're looking for a psychologist, how they could maybe see you as a patient.
Okay. My brain's trying to hold all those things. First, I think my book you can find on any major outlet. It's sold on Amazon and Barnes and Noble, all the kind of major bookstores. It's also available as Audible, which I like because I know for a lot of us, listening is a little bit more accessible. In regards to where you can find me on the internet, neurodivergentinsights.com is the best. I also have a weekly newsletter that I send out, and you can sign up for that through the website. Instagram is where I'm most active on social media, although I'm not, to protect my nervous system, I'm not actually on social media, but I post things there. So if you like infographics and visuals, you can check me out on Instagram. If you are an audio learner, then I also co-host a podcast, Divergent Conversations. It's me and another neurodivergent therapist. Maybe if you have kids, don't necessarily listen to it around them. There is some choice words we use at times. But we talk about the autistic ADHD experience, both through the clinical lens and through our lived experience. And then I actually have recently, I don't think I told you this before we started airing, but I actually recently closed my practice. I run a community, and that's where most of my energy is going right now, is toward a community of, it's an online community of neurodivergent adults that I run. And so that's probably, if they wanted more direct contact with me, I'm really active in that. And that's called the Learning Nook. And that's also, you can find more information about that through my website.
And if you can give us a summary, who would that be targeted towards? Who would be somebody that would be benefited in trying to reach with that?
Yeah, it's a common, right now we're about 250, 300, and about half of them are neurodivergent therapists. So there's a special kind of, if you're a clinician looking to connect with other clinicians, there's a special like area for you. But then most of the people are neurodivergent adults, typically in the first year or two post discovery. Most of us are autistic ADHD, but we also have autistic people, we have ADHDers. A lot of us are parents, and so we're in that unique experience of both being autistic or ADHD and parenting autistic ADHD children. That would be the demographic of folks. But most of the folks are later in life identified and newly identified when they're joining us.
That's great. A little bummed that you're not seeing clients. Again, trying
I
to search
know,
for more
sorry.
people out there who are working in this world, but obviously you have to know your limits, and you're telling people to respond to their limits and where can you put your energies. And obviously there's a need, and you're doing a lot of support with education online. And obviously as your parenting responsibilities shift over time and your kids have more autonomy when they're younger, they have a lot of needs.
They do. And for me, it was with my long COVID, my brain fog, which has made an appearance here in our podcast here and there. My brain fog is pretty hit or miss. And so clinical work, I was noticing, I just felt like I wasn't doing the work that I really like to be able to do, the kind of depth psychodynamic work that I do. Yes. So that was a hard decision, but I think was the right decision. But I do have, since you mentioned finding people, I do have a list on my resource page. I have a list of directories, many of neurodivergent affirming therapists, and even some assessment lists on there. So that is a place you could direct people to if they're looking to find.
Great. Yeah. I'll make sure that's on there as well. Again, thank you so much for being on the podcast.
Yeah, thanks so much for having me.
To summarize what we covered on the second half of this interview, we finished the talk on autistic burnout, examining triggers like life transitions, masking, and sensory overwhelm. Megan explains that burnout often occurs when stressors outweigh coping abilities, particularly in those who are unaware of their neurodivergence. She also shared the complexities of burnout, the importance of sensory self-care, and the impact of alexithymia. She also talked about self-care strategies for autistic individuals, the importance of accurate diagnosis, and how recognizing neurodivergence can lead to liberation and better self-understanding. She also shared advice for healthcare providers in encouraging and supporting autistic individuals, emphasizing the need for proper screening and developing effective communication. She shared the Self-Care for Autistic People book that she wrote and was published earlier this year. Also, there are links on the website where you can help understand autism better. I hope you've enjoyed this and all the other episodes. If you have, please hit the like, subscribe, leave a rating and review. That way, it will be easier to find for others who have similar struggles and yet have not heard a comprehensive biopsychosocial, spiritual, environmental approach to living with invisible illnesses like fibromyalgia. Until next week, go Team Fibro.